So normally in our clinical practice for treating patients with metastatic non-small cell lung cancer, we are reliant on tissue-based biomarkers like PD-L1 expression or next-generation sequencing biomarkers like tumor mutational burden to dictate whether we use immunotherapy alone or in combination with chemotherapy. However, these markers are inaccurate. It's well known that there are responders and non-responders that are not identified by these biomarkers. And so identifying better biomarkers or markers that could augment those is really important in clinical practice. And radiology offers a really neat but unexplored avenue for detecting markers of immunotherapy response. So what we did is we trained a deep learning model based on over 11,000 CT scans and that was used to predict progression among patients receiving immunotherapy. And then we validated that model among a cohort of over 500 patients split between a real-world data set and a phase 1 clinical trial data set to see if the biomarker actually was predictive in a holdout data set that wasn't involved in model training from a completely separate population. And what we found was that our deep learning biomarker, whether it was image alone or enhanced with other clinical predictive tools, was more accurate than traditional radiomic biomarkers and PD-L1 expression, with generally about 10 to 15% better performance. And so we've not only built a model, but we've also been able to integrate a platform that does automated quality control of images in a completely automated fashion without reliance on manual annotation. And so this offers promising signs of scalability for this type of technology. And hopefully if we can integrate this as a companion diagnostic alongside prospective trials, it can lead to better access to more sophisticated diagnostics for our patients.